Good evening. Hi. It's a beautiful Wednesday evening in most of the globe. And what better day than to decide what you're going to do with the rest of your week? So, a lot of times we wait for pinnacles in our lives to change things, change our views, change our plans. That's why on Monday I was talking about New Year's resolution or Monday resolution. So how about we do a Wednesday resolution? And I challenge you all to take a look at what's happening in your life and just see it with the eyes of a child and wonder, what exciting thing might happen tomorrow or the day after. And it could be your turn for the miracle. So I've had a few wonderful miracles come through in the last few weeks, and I know that this fertility journey could be challenging in all age groups, but especially in the 40 plus fabulous girls and boys. So I think that sharing is caring and giving is receiving. So sharing is also loving. And what better way of loving you than sharing those moments of joy of others to inspire you, because it could be very well your turn. So last week, I had one of my beloved patients. I hope she's watching. One of the wonderful 40 plus ladies that we've been working personally together for about close to a year. But her fertility journey started about 4 or 5 years ago. She is a physician, as a matter of fact, and she found the love of her life in her late 30s, early 40s. And of course, she was aware, being in the medical field, that she needed to get on it quickly. And she and her husband decided that they would try for a short time on their own, which they did, and didn't work out as they anticipated. And that if they were going to seek fertility treatment, it was going to be through IVF to try to get genetically tested embryos. She did her first few cycles with a local IVF clinic. Um, Part of her own miracle is that in her 40s, she was still having an AMH close to 2, and some of you might relate to this story. And her first few IVF cycles, she got a decent amount of eggs and a decent amount of blastocysts, which is pretty remarkable just right there and then. It's a miracle in itself, pretty remarkable for a 41, 42-year-old. So she had a few blastocysts that were able to get biopsied. But as some of you will relate to this as well, you sometimes have to be ready for the answer before you ask the question. And the first IVF, all embryos were abnormal. So what do you do with that information? It kind of leaves you in a weird space. Then the second IVF, she ended up having 2 normal embryos, and she went to the third IVF, and I think she had one more normal embryo. She decided at that point to transfer, and then they would not stick. So I believe it was after her third, fourth IVF cycle with the local clinic, she came to us, and she went through 2 IVF cycles. She's done everything you can possibly imagine, from human growth hormone to IV infusions. We've been working together, PRP, the whole 9 yards. One of her cycles did not do as good as she anticipated, so we did convert to IUI on that cycle, and we were crossing our fingers and praying that it was her turn. And unfortunately, she did not get pregnant, even though she had 3 potential follicles that could be mature eggs. But this is how it all works out, and that's why I love sharing the stories. She was a little devastated and exhausted, and thousands of dollars in, and she had to walk away for a little bit and take a break. She kept doing the supplements, and but that was pretty much it. She stopped just everything else. Okay. And last week, at the age of 45, she called me and we both celebrated that she got pregnant naturally. So her first labs showed normal progesterone and an ACG of 248. And that was last Friday. Monday's ACG went up to 600 and change. So we're extremely excited, and waiting for that. And I told her, you have to let go, because what is a baby? What is a baby? It's a miracle. It's the miracle of life. And I've said many times, over Facebook and individually with my patients, there is a reason why IVF is only 50% chance of success. Okay. Even though after 50 years of trying this and trying that across the nation is 50% chance of success, from IVF to a live birth. And, part of it is, yes, there's so much that we don't know how our universe and how our bodies work, but also there is divine intervention. There is the intangible that is involved. There is the emotions, the stressors. How is that affecting our genetic composition? There is a new branch of science called epigenetics, and it talks about how our emotions and our thought process actually turn on and off some of the genes. Whether, if you're a happy person and try to be a positive person, it turns on longevity genes. If you're always upset, anxious, and sad, it will turn off some of the accelerated aging and even cancer genes. So there's so much in our world, inner and outer universe, that is unknown. So it's so important to realize that every life, it's a miracle in itself. So I wanted to share that story with you. I've been sharing it for the last few days because I'm super excited. I can't wait to meet her bean baby and follow her through pregnancy, even if it's from a distance, and celebrate that wonderful miracle for her and for everybody out there that's trying to get pregnant past 40. Just like that, I can say a few other stories, but let's start seeing what you guys have to share. Okay, so Sally's sharing with us that she was 40, got pregnant naturally, and had a miscarriage at 8 weeks. And then she used the supplements, and the book starts with the egg. I read the book. I really like it. I think that she presents the supplements in the appropriate light. And she backs up her information with like medical and scientific research. I love that she actually points out that DHEA is a testosterone, and that should be used carefully. And Sally, not because you had a miscarriage means it's going to happen again. 10% of all pregnancies are lost, even on younger women. It doesn't really matter. That's just a natural statistic. I know that's not exactly great news, but you got pregnant and you definitely can do it again. You might just need a little bit of help this time, just to move along. Do you have to take progesterone if you're trying at 40? You don't absolutely have to. If your cycles are more than 26 days, most likely not. If you're concerned, you can always do a cycle day 21 progesterone and verify that you're making enough progesterone before you supplement. My patient that I just described, she is 45. She was very worried, so we did check her day. Actually, she was pregnant, so it was not even a day 21 because she was not. She was actually getting ready to do her IVF number 10. It's just her August period never came, but her progesterone is normal, and I told her you don't need progesterone on a natural cycle, even an IUI cycle or medicated cycle. We're looking for progesterone higher than 10. in general, that's the marker. I know that for IVF, we like it higher than 30, but that's just being super psycho and super, hardcore. I am 44, have had a tubal, not wanting to try to conceive through IVF. I'm already taking supplements and have an appointment in September. Is there anything else I can do to prepare? So yes, several things. One, you could be doing a low carb diet. There's a lot of information out there about being keto. Dr. Kills from CNY Fertility, he's about being carnivore 100%. But you really want to be on that extreme. If that might be too much for you, you really want to get off grains, nightshades, and milk. Okay. Nightshades are peanuts, walnuts, beans, peppers. Anything that grows in a vine tends to be very allergenic, so cause a lot of reactions in the immune system. If the immune system is tied up with dealing with antigens from our environment or invaders, there's not that much energy into healing and rejuvenation, okay? Restructuring and restoring, okay? That's the reason that we're so adamant about the diet and some of the immune protocols that we use, is that a lot of times, whether it is innate in our bodies, okay, or just with age, our biological reserve decreases. So anything in favor of restoring and healing, it's going to give you that tiny bit more of advantage, and you just need enough to tilt it towards you, right, towards the goal that you're seeking. If your tubes are tied, then I would recommend intra-ovarian PRP for you. I can't talk about enough. I am a believer. I am a user. I've been using PRP for 10 years, and I just had a 42-year-old in my office, was my last patient, beautiful lady, and we're going to prep her. She has an AMH of 0.13, and she really wants to try to do her eggs, at least do her eggs and add-on eggs. So we're going to try to prep her, and so we're going to do serial PRP supplements in Iraria. Okay. Another thing, you could be priming either with low dose human growth hormone or low dose ACG as well. And I would probably check on your hormones just in case your testosterones are low, your DHEA is low, and then you can supplement, correct thyroid issues, any possible prediabetes, get on metformin, all of those things you can start doing prior to IVF in order to improve your outcomes. Miss Monette, I have never gotten pregnant. I'm 30. They believe one tube is blocked. So I would check to see if one tube or both tubes are blocked, if there's anything else that might be obstructing your female organs. And, ovarian reserve, even your partner, just it takes two to tango. So it takes an egg and a sperm to get a baby. So a lot of times we focus on the female, but we do have to check on the man. I had about 6 months ago, I had a successful tubal reversal. And when our initial consult came along, they did not want to address him because he had children from a previous marriage. So he did not want to do a semen analysis. And she came back 6 months after her tubal reversal, no pregnancy. We rechecked everything on her. Her tubes were still open, both of them. They had a good length at the end of surgery. Her ovarian reserve was good, uterus was good. So he finally agreed to do a semen analysis, and he had all of it was low. Low count, low motility, low morphology, because our bodies do change, okay? Hi, Lisa. I'm sorry we missed each other. Okay. I see. So you are thinking whether to push your date, blast, and test. I would not do that at all. You are one of the blessed ones that can still get eggs, a good amount of eggs. eggs past 40, they're not necessarily abnormal. I've seen beautiful babies come out of 40 plus girls. But you don't want to imagine just when they're fresh and you push them to blast, we lose a lot of them. You're trying to defrost, biopsy, which is a traumatic experience for the embryo, and refreeze to then defrost again. So you're going to lose a lot of those. And just like I was discussing with my 41-year-old today, who's about to start her 5th or 6th IVF cycle, a normal embryo does not guarantee a pregnancy. So please take that into consideration, because you easily could lose half of those embryos just with the whole process of freezing, defreezing, biopsy, etc. Should progesterone and estradiol levels rise after the transfer to indicate success? That doesn't always happen. And I do get a lot of patients completely freak out when those levels go up and down. Our hormones are never static in our bodies, even our ACGs. I had a patient a few, like maybe 6 months ago, and her ACG went up like really good. Like it was like 200, 600, 4,000, and then dropped to 3,000. She almost had a meltdown, and then it started rising again. And she's completely fine. She has a normal intrauterine pregnancy. She should be delivering in the next few weeks or so. So they're not static. We do kind of put a line of the minimum. I think the estradiol, we'd like to see it around 200-300. The progesterone for IVF and transfers, we try to keep it 30 and above. But I mean, let's say yours is 40 and drop to like 32. That would not, even if it drops to 28, it would still not be a reason to panic. It'll fluctuate to some degree. The estradiol tends to eventually pick up, but mostly after the placenta takes over, which is between 12 and 14 weeks. I had a patient come in today. We were about to discharge her. She is 12 weeks. Yes, so we were weaning her off the progesterone to discharge her to obstetrics, and she took a dive. I mean, her progesterone went down to 17. That made me a little nervous. So we put her back on progesterone, and we're going to recheck it at 14 weeks. It's definitely by 14 weeks, the placenta and the pregnancy is self-sustained. I'm 42 and my husband is over 50. Will malfactor despite of normal testosterone? Recommendations for him? There's plenty of supplements. If it's a mild issue, I mean, he could do vitamin D. CoQ10 is very important for motility in men. He could do something called male endocrine from Systemic Formula. You can definitely call the office 770-266-0933 or message me through Messenger. Just make sure you give me your name and date of birth and phone number. Omega-3, good quality, food-based, like non-rancid omega-3. Oils is complicated. Zinc, selenium, vitamin E, and just a general good all-around vitamin for him. Okay, so I guess Miss Carol and Jacqueline, I talked about, I've been doing male PRP as well, especially on the borderlines. I had a spontaneous pregnancy after a male PRP to the testicles. If it's like really severe, I have this one patient, and I wish I could, really improve it for him, but his case is pretty severe. And so even though his testosterone improved, his male function improved, we did not see a significant improvement in his semen analysis, but it was very severe. So he's going to attempt a TESA, to a testicular biopsy, see if we can get any sperm, or even a TESI, which is under anesthesia, more aggressive, open testicular biopsy to see if we find any sperm. But people with kind of borderline that need a little push, male PRP is also going to be a really good thing. Does your estradiol levels need to increase during IUI cycle as well? Yes, they will behave very similar. Now, with an IUI cycle or a natural or natural modified FET cycle, you're going to be producing your own hormones. So a lot of times I will try those cycles. What happens so those fluctuations are going to be less because we're supplementing and you're making your own. But with medicated FET cycles, the problem is that you did not ovulate. So we're supplementing all of it. So those ups and downs until the placenta takes over might be a little bit more marked. But IUI, you have ovulated, so there'll be a natural increase. It won't be linear. There'll be some zigzagging, but yes, until the placenta takes over. Do you think in the 40s it is beneficial to skip months when transfer fails? I did June, July, then ERA. I think that yes. The title of today's talk is about maybe it's time for your miracle. Just like my beautiful, physician is pregnant at 45 spontaneously after 9 IVFs, all the transfers in between, PGT testing, and all of the testing that you can possibly do. She just got pregnant on her own. I had another beautiful lady from New York, same scenario. I met her when she was dealing with an ectopic from one of her transfers. And, I just told her, you need to stop and take a break and go have a vacation with your husband and please have sex for the sake of having sex and get drunk. Yes, go, enjoy yourself, have bread during, your dinner and have a few glasses of wine. And with her, we were prepping and she wanted to take one vacation before doing her next IVF cycle, and she was spontaneously pregnant at 41. Today, her baby boy is 2 years old, beautiful. There's absolutely, he's just gorgeous. So a lot of times, like I was saying at the beginning, it is the miracle of life. Okay, there is art and spirit in the science of medicine. So sometimes we just have to give ourselves a break and practice of self-love, because what is a baby but the physical manifestation of love? And love starts with you. You need to love you. You need to relax. If you need to step back and take a break because this is emotionally, financially, and physically draining, please go ahead. No, your clock is not ticking, and this is not a race because every minute you're getting older. I know that's the little voice in our heads, but we need to stop. What is the worst case scenario? You need to buy eggs. That is not that bad either. Okay, it's not what we want, but it's not that bad either. So taking a little break to give you a break might be exactly what you need to be successful. And suddenly it might be your turn for that miracle. Empty follicle, why and how to improve. I had that issue last week. It happens a lot with people that are kind of PCOS or decreased ovarian reserve patients, especially when they don't respond very well. Priming both ends, just trying to optimize the functionality of the ovaries. So PRP diet, supplements, ACG, metformin. Metformin, even on non-PCOS, non-diabetic patients, has been shown to really improve overall longevity, decrease chances of Alzheimer. They're talking about it in the anti-aging groups, like it's like God gift to the world. So even those little changes to try to improve that, looking at your IVF cycle or IUI cycle, whatever cycle you did. I'm assuming that if it's empty follicles, it was an IVF cycle. Then you want to see, did you stimulate too fast? At what point were you triggered? Could you have ovulated early? So you have to go kind of dig a little bit and see how it can be improved. Maybe change the protocol. A lot of times people will ovulate early and you can see it, or if the eggs inside the follicles are degenerating, you're going to see either a plateau or even decrease in estrogen production. A healthy follicle, healthy egg, it's going to make estrogen. Okay, that's why if you had a lot of follicles, we're all freaking out about the hyperstimulation syndrome, but that's estrogen related. So you want to look, that's the reason we do so much blood work, because we need to correlate the ultrasound with what's happening in your body. And those FSH, LH, estrogen, and progesterone gives us a lot of information. All right. Yes, COVID is a big one. COVID seems to affect fertility in both men and women. That's what I've been seeing. I had a New Jersey beautiful couple. I love them to death. Actually, I did surgery on her yesterday. The issue is that she's dealing with endometriosis, or their issue was that she was dealing with endometriosis and low ovarian reserve. And then he ended up having COVID, and then we decided, because she's been doing so much IVF, so we kind of switched things a little bit, and she decided on doing an IUI cycle just to spice it up. But it was like maybe a month or two after he had COVID, his semen analysis was crappy. I've seen that too with even women. There's like this dive in the AMH after COVID. So you kind of have to kind of let your body recoup. So once all your symptoms are gone and once you feel better, I would check where you landed, and then I would do priming. I would, PRP, supplements, maybe a few letrozole cycles with time intercourse from home, just to get that ovaries kind of up and running again. All right. When you're 40 and you have only a few 3 days embryos, which transfer is better? Fresh is always better. Fresh is always better for 40 plus ladies, especially when you don't make too many eggs. Because like I was saying earlier, it might be that doesn't mean that your eggs are bad. They're just more frail. Okay. I mean, just think about your entire body. Let's say you're 42. You might be a young 42 and fabulous. Okay. But you do know that your body behaves different than when you were 20. It behaves different. It needs a little bit more loving. It needs a little bit more tweaking. Your eggs are just part of who you are. So, I mean, your body works fine and you're absolutely wonderful and fabulous and beautiful, but you need a little bit more loving. So your eggs need a little bit more loving too. So fresh, absolutely, especially with not a lot of eggs and not a lot of other issues. What would be the exception? If you have active endometriosis, that tilts the balance towards frozen, because I've seen that it's so much better for endometriosis patients to do 30 to 60 days of suppression prior to transfer. Okay, last question of the evening. 48, fabulous and beautiful and young, and just had her first baseline for FET cycle with donor eggs and had several ovarian cysts on both sides. It doesn't matter, especially if you're doing a medicated cycle, which is a suppressive cycle. They should go away with the amount of estrogen that we're going to put you on. Okay. All right, everybody. Thank you for joining me. Wednesday nights is going to be our 40 Fabulous and Fertile group gathering. Of course, everybody's welcomed. And remember, sharing is caring and giving is receiving is the law of the universe. So many, many hugs and kisses for everybody. I'll see you next week. Tomorrow morning will be our Spanish time at 7:30 in the morning. Bye-bye.